Is new research into congestive heart failure leading to better outcomes? Joining us on today's Heart of the Matter with Answers is Dr. Frank Mcgrew, Director of Cardiovascular Research and Clinical Cardiologist at the Stern Cardiovascular Foundation. Thanks for joining us, Dr. Mcgrew.
Thank you, Joe.
Can you tell us what congestive heart failure is?
Congestive heart failure is defined in most cases as a heart muscle that's weak and flabby and enlarged and is unable to pump blood to the rest of the body, and also causes blood to back up in the lungs. So it causes two types of symptoms, fatigue and shortness of breath in general.
How is congestive heart failure treated, and how effective are those treatments?
Heart failure is treated in many different ways. We've actually been doing research here at our center for over 90 years, going back to when the original Dr. Stern used digitalis. We've evolved now, and we have about 7 different drugs that are now FDA approved to treat heart failure. They've all been studied here in various research studies through the time. Despite these, though, we still have a lot of need for improvement. We've done a lot of research into devices like pacemakers and defibrillators that help. But despite all these advances and multiple medicines, the electrical devices, there's still a lot of room for improvement to make people feel better and to live longer with congestive heart failure.
Let's talk about new research. How are stem cells being used in the treatment process?
We've known only for a relatively short period of time that there is a stem cell mechanism for the heart to repair itself. It used to be believed that once heart muscle was destroyed or gone, that it could never come back. But we now know that that's not quite true. There are stem cells in the bone marrow that everyone has that, when properly stimulated, can move into the heart either through the blood system or through our mechanical devices that can cause new heart cells to form in the heart, making it beat stronger and to get more blood flow to it.
Where did the stem cells come from, and how do they get into the heart?
We actually know that there is an abundance of stem cells within every patient's bone marrow. These actually move into the heart to a low-level degree in almost all of us, but usually are in numbers too small to be of any benefit. But we can enhance that by 2 different mechanisms. One is to actually harvest the bone marrow by going into the hip, putting that into a test tube, selecting out certain very potent cells, and injecting them back into the heart muscle using a small needle, again with a heart catheterization technique, all done under local anesthesia without doing surgery. Another mechanism is to give a special hormone through the bloodstream that stimulates the bone marrow to make more stem cells and release them into the blood. They are then removed with a technique called plasmapheresis and then injected into the heart through a similar mechanism.
How is human gene therapy being used for CHF?
We know that patients who have congestive heart failure are deficient in certain genes in the heart that form proteins that cause the heart to beat stronger, that make the muscle perform more efficiently. We now have a way to take these genes and put them into the heart to get more proteins. A human gene called SERCA2 is made in a lab, and then it's encapsulated in a small viral particle known as an associated adenovirus. This viral particle is not a true infective agent, but is similar to one of the agents of the common cold. This human gene is packaged inside this viral particle, then it's injected into the heart arteries using standard heart catheterization techniques. Then the gene affixes to the heart cells, causing more protein to be formed, which will make the heart cells beat stronger and faster, and in pilot studies has shown to improve the symptoms of congestive heart failure.
What other types of research are underway to help treat the problem?
There are several new devices that are being investigated. We have a device now that's much like a pacemaker, but instead of making the heart beat faster, it makes it beat stronger by using a low-level electrical current. We also are looking into several new innovative medications that may make the heart beat better also. There are several new molecules that can be given both intravenously and by mouth that actually function as an energy strengthening device to the heart to make it beat stronger. The ability to have such a medicine has eluded our research for several years now, but we think we may be on the track of finding a drug that can be taken orally that will make the heart beat stronger and alleviate some of the symptoms of congestive heart failure.
Dr. Frank Mcgrew of the Stern Cardiovascular Foundation, thank you so much for joining us today on Smart Medicine.
Thank you.